This is Chris from PetAbility. Today we're going to be discussing therapeutic massage. Massage is one of the oldest forms of therapy and has so many beneficial effects for any being. If you've ever had a massage yourself, you know how good it feels. It affects your muscles, which people think of mostly, but it also affects your circulation, your nervous system, your lymphatics, and many other tissues. Specifically, massage not only promotes relaxation, but it enhances blood flow, diminishes pain, loosens tight tissues, and one of the really cool things is it enhances your bond with your pet. I think it's important not to overthink things, but I do try to be methodical when I am doing a massage session. Now, many times we can catch as catch can, and I'll show you some of that a little later on. But today, I'm going to start at Libby's head. I like to start at her head when she's relaxed and lying down. Again, always important to get their buy-in, to make sure that the environment is free of distractions, and that you're both in the mood to do this. If you're stressed out, your dog's stressed out, energetic, that's not the ideal time to do massage. So by starting at her head, there's a few things I can do. One, let's not forget that the muscles that are used for chewing, the muscles of mastication, are actually on the skull. So I do try to do a little bit of massage on the skull to start, to get them to relax. There is actually a relaxation point between their eyes, and sometimes it's good to tap that or put some pressure there if they're still being a little bit cuckoo. The other thing is their ear canal is very long and it's shaped like an L and basically runs from the corner of their eye up to the opening of their ear. This is a good opportunity as well to kind of milk any debris that might be trapped in that very vacuous ear canal up toward the surface. Then when your dog shakes its head, it actually gets rid of that debris in their ears. So that can be quite helpful and gives you an opportunity to see if there's any signs of ear infection, if there's an odor, things like that. So again, one of the greatest benefits of laying your hands on your dog is that you get to assess from session to session what may be different, what's going on in their tissues. Is there a little bump that you didn't feel before? It's springtime here in New England, so the ticks are coming out. And I have found a few ticks already in some dogs that I've been treating. So check for ticks. Maybe there's a lump that you didn't notice before. Is that something to be alarmed by? Let's bring that to the attention of your veterinarian. And again, even things like using the back of your hands to assess warmth, which could be a sign of inflammation. If you notice that, wow, she feels really warm in this area, that could be a problem musculoskeletally when you compare it to the rest of her body, which may not feel quite so warm. The back of your hand is quite sensitive to temperature. So after I've worked on her skull, I'm going to proceed down to her cervical or neck region. Now, Libby still has on her collar. I'm going to remove that. Sometimes that can be a stimulus cue to let your dog know that it's not work time, it's actually relaxation time. And when they put the collar on, then, okay, we're ready to go out for a walk or maybe do some exercise, things like that. So there are two basic strokes that we generally use when we're performing massage. One is more of an open-handed, broad stroke that is going towards the pet's heart. You're actually trying to facilitate the flow of venous blood and get waste products back to your body's organs so they can be processed and gotten rid of. We don't want things to stagnate in tissue for a period of time. So again, I'll usually start a little bit lighter, getting my pet relaxed and doing some of these broad strokes. Now, you might say, well, where's the pet's heart? I have a general idea, but maybe I could tell you a little bit more exactly. If you bend the elbow up toward the rib cage, the heart lies right at the point of where that elbow bends. So generally, you're going toward the body's center when you're doing these effleurage strokes. If you feel something that might require a little deeper massage or some different techniques, then we do what's called petrissage. Basically, that's anything else. It could be pressure, it could be kneading, it could be lifting the tissue. There's a whole variety of techniques, and don't be afraid to experiment and learn what your pet likes most. Libby is quite relaxed and ready for me to engage in specific areas of her body. So back to her neck or cervical region. I think it's important to not just massage what you can see, but also to reach around to the undersides of limbs and such. So when it comes to her neck, I'm actually going to go from the base of her skull, because there's a ton of layer upon layer upon layer of muscles that strap between the shoulder blade, shoulder girdle, upper arm, and the cervical region. And you want to not ignore any of those if possible. So back to being kind of methodical, I'm now doing some petrissage in her neck region. The muscles on each side of the spine from head to tail are very thick. And so if your pet is tolerating it, you can gradually get deeper and deeper to affect the deeper layers of those muscles. I'm also, you know how dogs have a lot of skin around their neck in general? One of the methods and techniques that I like to do is actually grabbing that scruff. You don't want to just pick up a little bit. That's like pulling one hair. You know how that hurts. But if you get everything and lift it, that's actually a terrific release for the neck region. Now, I want to remind you that most dogs put a majority of their weight, about 60% of their weight, on their front limbs. So it's not uncommon to have a lot of tension through the shoulders and neck area. Especially as dogs get older, they'll start shifting more weight to the front. Or if they've had a hind limb injury due to compensation, they'll put more weight on the front. So I kind of think of the front limbs as doing like a sports massage. You know, we're trying to maybe work out some of that lactic acid, get deeper, loosen those tissues, etc. Now, one thing I also want to point out is I try not to remove my hand and set it back down on Libby. I want my hands to do the talking. So imagine if Libby's eyes are closed and I'm working here, and then suddenly I go. That could be very startling to her because she's not expecting that. However, if I'm here and I glide my hands down to the next area, then she knows exactly where I am at all times. I think that is something worth remembering. So I typically like to go kind of around the edges of the bones, if you will. You'll get very familiar with your pet's anatomy the more you do this, but it really doesn't matter. You don't have to take a course in canine anatomy or anything like this, but you'll feel the bones. And that's where the muscles attach. There's called an insertion and an origin for every muscle. And oftentimes that's an area where it's tight and sore. Contrary to most beliefs where you might think it might be the middle of that muscle belly. But we want to really try to span that entire length of that muscle. So I'm feeling her shoulder blade, which lies right here. There's kind of a bone in the middle. And I'm going above that shoulder blade on the head side and below that shoulder blade on the tail side. I also want to work the muscles directly on top of that shoulder blade. So again, when I'm gliding this direction, that would be effleurage. When I'm using compression, maybe doing some small circles, that would be a form of petrissage. Just fancy French words for getting your hands on your dog. So now I'm lifting Libby's arm gently, and she's fine with that. So I can access more of that armpit or axilla area and her pect muscles, which kind of feel like a bra across her chest. They go from the shoulder to her sternum, her breastbone there, and Libby's got some jacked pectoralis muscles, so I always make sure that I really work those. And if they're running this way, you know, I might pull up on them a little bit, I might push down on them a little bit, I might run along the length of those muscles. I also want to go all the way down to the feet. So again, doing some effleurage, going up toward the heart, which is about right here. Now, majority of a dog's muscles or your pet's muscles are going to be what we call proximally, up toward their body, versus distally down toward the periphery or their foot. But it's still important to do some stroking to, as we said earlier, see if there's any changes there and so forth. So remember that a dog's anatomy is very much like ours. So most of our muscles are up here too, but we still have muscles and tendons and all kinds of tissues, nervous tissue, blood vessels that can benefit from massage as we go farther down. And if any of you have listened to our podcast, you know that Cathy and I both love feet. So don't ignore those toes. Sometimes lameness can be a result of just something going on in your pet's toes. So I'm doing a little stroking here, massaging over the top side. I can kind of get in between the pads. I just had a dog yesterday that I found 2 pine needles stuck in the fur between her pads. And I know that couldn't have been comfortable when she was walking on there. So great to address that area as well. So now I'm going to be working my way back toward Libby's hind end. Now that I've gotten her relaxed, I'm less concerned that she might pop up. If I started at a rear end, she might be curious about what I'm doing and continue to try to get up. And really, again, ideally, I don't want, it's true to form, just like I said, I don't want Libby to be engaging her muscles, so I do want her nice and relaxed so that the muscles are supple and will be most receptive to my manipulation. Now, I did notice as I was coming back here, I'm like, oh, I feel something. What is it? And I explored, and she's got just a little knot in her hair there. And so if I was Libby's owner and I noticed that, I'd go grab the scissors and cut that right out. So again, just a real-time example of things you might find. A small knot can become a big one over time if we don't address it. So I'm just kind of scooting back here. We talked about the effleurage going toward the heart. We talked about how deep those paraspinal muscles are. And so I'm using the heel of my hand. This is called the hypothenar eminence, and this is the thenar eminence. And those are fleshy areas of people's hands. Oh, Libby, here you go. Lay down, girl. And that can be more comfortable versus being pokey. I don't want to be using my, see how she didn't like that? I don't want to be using my fingertips to engage. Now that I went back to the heel of my hand, she laid right down. So again, sometimes if we think about what's going to feel good to us and impart that to our animals, that goes a long, long way. So I started with some effleurage going up toward her heart. Now I do get asked a lot of times, wow, you're going against the grain. The fur grows this way. But again, it's not uncomfortable for dogs typically. If you notice that you're kind of pulling some hairs and your dog's reacting to that, then you can certainly go the other direction. But generally we want to go toward the heart following the venous return of blood flow. Then I'm going into some petrissage where I'm getting in there, doing some circular motions. You might have noticed I was doing like a little vibration along the spine. Again, very thick area. Don't have to be too cautious. As we get to more delicate regions like the toes, then we lighten our pressure, of course. So generally where you feel a lot of muscle and a lot of flesh, you can be more confident in going a little bit deeper. So now I've worked my way back to Libby's pelvis area. You take your flat hand and you feel a little bump there. That kind of tells you right where the center of the hip is. In the front of the hip are the quadricep muscles, and on the back of the hip are the hamstring muscles. 2 huge muscle groups in the dog that really benefit from a lot of massage. So again, effleurage, petrissage, and I mentioned earlier that we also want to get to those areas that we don't see. And dogs with hip issues, particularly hip dysplasia, will oftentimes be really tight and kind of sore in their groin region. And so getting in there on that inner thigh, sometimes I'll kind of sandwich the tissues. And but the most important thing is don't neglect that area. It could be very, very therapeutic and make your dog feel a lot better. And I'm hoping as I'm talking through this, you know, I've been doing this for almost 20 years. So it's become very innate with me, and I don't always verbalize what I'm doing. But the point of this video and this tutorial on our YouTube channel is that a picture is worth 1,000 words. So you will have access to this over and over and over again if you want to say, gosh, what was Chris doing, you know, to Libby's hind end? I'd like to do that to my dog because it seemed like she really enjoyed that. Then you can come and maybe pick up a few techniques as you're watching here. So just like in the front leg, there's not as much flesh as you're going down toward the foot. So instead of using the heel of my hand, I'm now keeping my fingers together. You don't want to dig your fingernails in. You can imagine how that wouldn't feel comfortable. Keeping my fingertips up and working the muscles on the lower leg. The calf muscle comes up, you feel a little ropey thing, that's the Achilles, and then there's the gastroc and the soleus that are right behind the knee there, and that can get tight. And then of course, don't neglect the foot. So I'm gonna look at each toe, feel each toe, I should say, go between the toes, go between the foot pads on the bottom. Just make sure there's not any foreign material. Maybe desensitizing your dog in a very healthy way. If you can touch your dog's feet and then maybe treat them, perhaps they won't be as freaked out about maybe getting that nail trim that's so necessary. Now, I did mention giving them a treat. I have learned over the years that if I am constantly giving treats, the dog gets excited. And so generally, I want to get them relaxed. And if they need a break, which, you know, they'll listen to your dog, they'll let you know, then maybe at that point I give them a treat for settling back down after they've had that break. Or at the end of the session, we throw a little party and let them know that they did a good job, that they were very cooperative. But if we're constantly giving them treats, they're engaging their muscles, they're trying to get up, see when that next treat is coming, and so forth. We talked before about how many layers of muscle there is in the shoulder girdle. Well, the same goes for the pelvic region. So again, if I can find that hip joint by pressing down with my flat hand and feeling a little ball there, because it is a ball and socket joint. This is actually the greater trochanter where a lot of muscles attach. Then that's where I want to center my claw. So I found it, it's right there. I'm going to take my claw, Lady Gaga style, and I'm going to go right over that hip region. And really, you should be going as vigorously and as deep as you can, if your dog can tolerate it, to free up those tissue layers all the way down, deep, deep, deep. And if you're doing it right, you're going to get fatigued. So I'm already getting a little tired here. And you can see I'm kind of going back and forth. I could also switch and go up and down. That doesn't really matter, but really getting in there for that hip. So I love the claw technique. And you can see Libby's quite relaxed. She was a little curious when we first started, but then she laid right back down. Generally, I want to make a point too of saying that when we are slow with our strokes and use pressure, that is calming in effect. If we're moving fast and vigorously, that's excitatory. So think about what you want in that time. If your dog generally needs to be kind of pumped up to exercise, you're doing this before you're getting ready to go out on a walk or an exercise session, maybe more excitatory. If you're coming back in from that walk, you want them to rest and you're using that as a cool down, then maybe more gentle stroking, more superficial and deep diffuse pressure. So I certainly appreciate that not all of you are going to be able to get your dog to just relax into a sideline position. Over time, I think that will happen, but everybody and every dog's personality is different, and they just may not trust the process yet. But that doesn't mean you can't massage your dog. You can certainly do a lot of the techniques that I demonstrated in standing. So again, I can start at her head, those muscles for her jaw, see if there's any teeth soreness, any ear issues, working back through her neck region, kind of getting my hands on her, stroking. This is a nice little warm up as you stroke down each leg, that chest area. Okay, so now I'm there, coming in through those shoulders, really pressing now because again, it's thicker tissue. Going along the spine, working my way back. If my dog wants to sit, I can just put my hand gently under their belly, just giving her a cue. I'm not lifting up at all, just a cue so that she doesn't want to sit or lie down. And then coming back again to those back legs, hamstrings, quadriceps, hip. I can do the claw standing. And again, I could certainly get into that inner thigh with my hand and massage there. You'll notice when your dog is upright that the muscles and tissues are going to feel a bit harder because, again, they're engaged. They're using their muscles to support themselves against gravity. So I just quickly kind of checked out her foot, working on balance at the same time. If your dog can't stand on 3 legs, of course, skip that. But this allows me, when she's standing and her back is to me, to do actually both sides at the same time. So it can be quite efficient, again, as a warm-up before you head out, or as a cool down when you're coming back home. You done? You leaving? So the duration of a massage treatment can be highly variable. It depends on your dog's consent. Be willing to start out very briefly, make it positive, and when they need a break, give them a break. Other factors to consider would be their age, their condition. Really listen and be in tune with your pet, because there are many variables that will impact the duration of a massage session. One day, you might get 20 minutes in. The next day, you abort mission at 2. Another factor to consider would be the size of your pet. Generally, if your pet's bigger, giant or large breed, it's going to take longer if you were doing a full body massage. Whereas a little, terrier, Yorkie, Chihuahua, it's not going to take nearly as long because there's not as much area to cover. But it really depends on your pet's response to the treatment. So make sure that you're listening to them at all times. And certainly err on the side of caution. It's better to be more brief. You don't overdo it. You make it positive, and versus going too long and making it uncomfortable, or they kind of resent that time going forward.